I have selected the amendment to the motion and I call on Caroline Jones to move Amendment 1, tabled in the name of Neil Hamilton.
I formally move the amendment tabled in the name of my colleague Neil Hamilton. Following our report in committee, I have been written to by many organisations, along with constituents, all opposing the minimum unit pricing. Therefore, I cannot share the premise that introducing minimum unit pricing is the correct way to address alcohol-related harm. Making alcohol more expensive will not stop people drinking to excess and is perceived to be unfair and penalises those who drink responsibly, particularly those on low incomes. There is growing evidence that the largest group of binge drinkers are middle-aged, high earners, and according to the Welsh Health Survey, 47% of the least deprived in Wales drink more than the recommended amount, and 28% of the least deprived in Wales are binge drinkers. 34% of men and 28% of women drank more than recommended limits on at least one day during the last week. Adults living in households in the highest income bracket are twice as likely to drink heavily as adults in the lowest income bracket. Evidence on purchasing behaviour presented to the Scottish Parliament's Health and Sport Committee showed that harmful drinkers in the highest income quintile are predicted to be buying 80 units a week of cheap alcohol. Increasing prices will do little to deter these people. Those in favour of minimum unit pricing for alcohol often point to Canada as a shining example of the policy working, but evidence from British Columbia show that between 2002 to 2011, alcohol-related deaths actually rose, as did hospital admissions attributable to alcohol. We should have learned from tobacco control measures that increasing prices does not deter heavy smokers, it just makes them poorer. And my concern here has always been the plight of children in a family where parents drink quite heavily. Often alcohol price increases, the children often go without and have a much poorer quality of life, therefore increasing inequality. I am afraid that minimum unit pricing will only lead to an increase in profits for the supermarkets and do little to encourage responsible drinking. There are concerns highlighted by the Huggard Centre that such legislation could lead to those struggling with alcohol addiction could be pushed into cheaper and readily available illegal drugs like spice. There is also concern that this legislation could fuel a move into black market alcohol, as we have seen with the tobacco trade, which has seen the trade in fake cigarettes containing very harmful chemicals explode. We also have to consider the fact that there are health benefits from responsible alcohol consumption, and more than 100 studies have shown that drinking 1 or 2 units of alcohol a day can actually reduce the risk of developing cardiovascular diseases by as much as 45%. However, I acknowledge drinking more than the recommended intake increases your risk of liver disease, can damage your heart and increase your chances of developing certain cancers. It is a balance that the majority of us manage, but sadly many do not. I agree with the Welsh Government that we have to do something to tackle the hundreds of alcohol-related deaths and tens of thousands of alcohol-related hospital admissions which occur each year. Minimum unit pricing, I feel, is not the way. We have to better educate the public about the harms of alcohol and better help those addicted to alcohol, but not penalise those who drink responsibly. Thank you.
Angela Burns.